So this is the question. What is metronidazole? It's a sulfur drug, right? At the same time, there's certain things you have to know about it. The thing, it has a metallic taste, so it's normal, right? It turns your urine brown, rusted color. That's normal, right? You're supposed to not take any alcohol 48 hours and 48 hours after you finish the last dose, right? Because you cannot drink alcohol, you got to teach the patient anything that contain alcohol, they should not drink or touch it. So like hand sanitizers, you should not do that. Cologne, you should not do that. Perfumes, you should not do that. Vinegar, it contains some alcohol. So this patient should not do that. So that was the content. The content is alcohol, but there's a certain things in alcohol that has alcohol that is in disguised. You have to teach the patient a list of information. Otherwise, they get sick by not following. They'll think they're not going to the liquor store and buy alcohol. They may be touching something that contains alcohol. So this one, you can't have some vinegar. It's wrong answer. Okay, and I give you some quick reason for that. This is the buzzword and the key fact. You don't need a whole page of explanation. This is all you need to answer the question. Same thing I'll be doing. Which statement by the client require follow-up? That means I need to require something they're doing that is wrong. So I need to follow up on that, right? And then provide care for a client, prescribe the same thing, sulfur-based antibiotic. How do you answer this question? I've underlined the buzzword, sulfur-based antibiotic and require follow-up. There's certain things about sulfur drug you should know. That's all. Certain things about sulfur drug, but that sulfur drug is antibiotics. There's only few sulfur drug that are antibiotic, and there's a broad information about each of them, right? So sulfur drugs would lead to kidney stone. Because of that, you got to what? Drink a lot of water. You got to drink a lot of water with it. So you got to drink a lot of water. So 2 to 3 liters of water a day. It's very, very important. All sulfur drugs are photosensitive. That means when you go outside, you're going to have a sunburn. So they wear long sleeves. You see the content I'm teaching you, right? These sulfur drugs, which are antibiotic, they make contraception inactive. Therefore, you got to wear barrier method. Sulfur drug, one of the side effects after photosensitivity is the small purple rash on the chest. That's Stevens-Johnson syndrome. And therefore, this one require follow-up. You should not use sterile cream when you see a small purple rash on your chest. That's Stevens-Johnson syndrome. You got to call me. Otherwise, you're going to get sick and you're going to die. So you see, it's the content, but you change it in disguise and ask these questions. That's what they do. And this is what I explained to you, keywords, right? And next, provide care for a client prescribed Linezolid for MRSA skin infection. The nurse has provided teaching to the client. Complete the following statement made by the client, right? So this looks like it's difficult, but it's not. Go and look for your buzzword. I always say the buzzword is what? Linezolid. What do you think? I've given you a clue. It's used for MRSA infection. What do you know about Linezolid and what do you think about it? So you have to break it down and say, hey, what is this antibiotic? What is that? Do I know anything about it? And what is it used for? At least it's an antibiotic. What do you think? This is the same thing as vancomycin. Vancomycin is given by IV, but if you can't give the patient IV, you give them oral Linezolid. The buzzword for this, look at the question. If you can figure out, then I'll give you the content. Think about it. I will avoid what? Milk, sun exposure, aged cheese, and then acetaminophen, citrulline, and aspirin. So tell me what you're going to avoid, the first one. Tell me what you're going to avoid. What do you think? I will avoid milk, sun exposure, and H's, or acetaminophen, citrulline, and aspirin. What do you guys think? You have to know what is linezolid. If you know, you'll be able to pick the answer choices easily from here to here. So what do you think? And I can give you the content, but I want you to try your luck. Try and see what answers are you going to choose. One. The content here is this. Linezolid, it has two things. It has MAOI features, and it has serotonin receptor features. One antibiotic, and it does two things. One antibiotic, it has MOI features, and it has serotonin features. So I've given you the answer now. I've given you the key fact. If he has MOI features, then you should avoid aged cheese. If he has SSRI features, you should avoid citrulline. That's all. That's the key aspect of this question. That's all. So aged cheese and citrulline is what you need to avoid because of the features associated with it. And that's what I told you explanation here. So that's the key. Another one, and it's provide care. Like I told you, these questions, I try to make it a little bit difficult, but make you think. And it's provide care for a client receiving IV antibiotic infusion. This EKG strip was noticed on the monitor. Which prescription the nurse should suspect? I'm not giving you anything. I told you there was antibiotic, patient is receiving, and then we saw this EKG strip. What is that? Critical thinking question. You have to go through so many steps. It's test-taking strategy. Figure out what this, if you figure out what this rhythm is, then you know what are the causes of it. If you know what are the causes of it, you go down and look for any antibiotic that can cause that. Study carefully. You see, this is all ventricular rhythm. It comes down here, and it goes up, and that. It looks like a snake. It's acting like a snake, right? You have something is meandering, and it's polymorphic. We call it polymorphic ventricular tachycardia. This is polymorphic ventricular tachycardia, which is called Torsades. This is Torsades pontis. So if this is the Torsades pontis, what kind of antibiotic do you know causes Torsades pontis? What are the antibiotics that causes Torsades pontis? It's usually not aminoglycosylate, right? Vancomycin doesn't do that, right? Erythromycin is a macrolide, and this is aminoglycosylate, and this is a penicillin derivative. The common antibiotic that do this is macrolide. So erythromycin is your right answer. It can be erythromycin or chlorothromycin. But those are the antibiotic that causes QT prolongation leading to Torsades pontis. Vancomycin doesn't do that. Amikacin causes ototoxicity, nephrotoxicity, and then neurotoxicity. So those are the things you have to worry about. So that's your right answer. So it's a little bit hard question, but you got to think about it. Multiple steps, like I said. And this is reviewing phone call from several clients, prioritization, right? This is another prioritization pharmacology. Which client need the first phone call? You got to be sharp. Who you have just 1 second? Who is going to get sick? Who is unexpected finding? There's no magic to prioritization. That's what I've given you. Is it a breathing problem, shock, sepsis, airway, and lethargy or neurological problem? Who do you have one? All you have is 1 second. Then you ask yourself, which one is an expected finding? No matter how bad is the problem, if it's expected, I ignore it, right? Then break the question down. I give you metronidazole, you have metallic taste. I give you amoxicillin, you have what? Diarrhea. I give you Linezolid, you taking quetiapine. I give you tetracycline, you have sunburn when you go outside. What is your right answer? What do you think is worrisome? Which feature is unexpected? So ask yourself. I've already explained this to you already. And so let's look at each one of them. Metronidazole, metallic taste is normal. Amoxicillin, you're going to have diarrhea. Linezolid, you should avoid SSRI. Quetiapine is an SSRI. This patient is going to go into serotonin syndrome. Tetracycline is a photosensitivity medication that has sulfa features. It can lead to sunburn. The right answer is C. That's your prioritization right there. Okay. And then provide care for a client prescribed what? Amikacin for severe systemic infection, right? Which client data will require follow-up before administration of the next dose? This is a good question. I want to test your mind. But don't worry. Don't forget about the amikacin, okay? Forget about the amikacin. Amikacin is a group of medication. Best way to answer this question, put it in the group. Amikacin is what kind of antibiotic, right? It's aminoglycosylide, right? It's aminoglycosides, right? What are the three features? They have three features you should know. Okay, they affect your kidney, they affect your ears, and affect your neuromuscular features. So neuromuscle, basically, neuromuscular junction. So these are the three things you have to worry about. Now, myasthenia gravis, creatinine 1.1, 18 BUN, white cell 24,000, temperature 100.2, blood pressure. Look at the question. Don't get trapped with this. This is all trap. It's made up of trappy question, right? Which clinical data require follow-up? The nurse about to give the patient amikacin. Which one require follow-up? Tell me, I'll give you your answers. So tell me which one. So what? History of myasthenia gravis. Does it require follow-up? Yes, it requires follow-up because neuromuscular and disease in myasthenia gravis, they already have a neuromuscular disease. So you should not give amikacin to somebody who has a neuromuscular disease. Myasthenia gravis, there's like lack of acetylcholine. They have neuromuscular problems. So this you require follow-up. How about creatinine 1.1? This creatinine is 1.1. Does this require follow-up? Is creatinine is normal? No. Is BUN is normal? No. Is white count 24,000? What do you want to do? Does it require follow-up? Does this white count 24,000 require follow-up? An infection, I expect this patient to have white count of 24,000. No follow-up. He has temperature 100.2. I expect him to have temperature, so no follow-up. His blood pressure is normal. No follow-up. This is the way the answer is supposed to look like. So these are the things you should watch for when they put it in the question. It doesn't has nothing. Patient has infection. So all these abnormal numbers is fine. You don't need to follow up on that. But if you get trapped, you just chase your tail. So don't do that. If things are normal, I expect if somebody with infection to have a fever, to have a white count, they are all expected finding. Don't chase it. That's why you got to be sharp when you're selecting your answers, right? So that's the answer for you. And then provide care for a client receiving Acyclovir for herpes infection. Which finding is concerning? You see how short the question is? I don't want to give it away, but I've given you everything in that question. Who knows what I've given you? What is the key word in the question? What is the key word in that question? And then provide care for a client receiving Acyclovir for herpes infection. which finding is concerning. What is the keyword for this question? What is the keyword? If you figure out the keyword, you got it. What is the buzzword for that question? What is the buzzword? What do you guys think? What is the buzzword? It's Acyclovir. Acyclovir is what? Antiviral medication. So it's a viral medication. It's going to take care of the herpes infection, right? There's something you have to know. When you're taking your NCLEX and you see a medication that has VIR, it's always antiviral. So it's an antiviral. One of the biggest side effects of antiviral is aplastic anemia. What is aplastic anemia? I'm giving you content that, I mean, you know what I mean? Like, so aplastic anemia means your white cells go down, your platelets go down, your RBC, everything goes down. So these patients are very weak, they have a bleeding problem, and they are at risk of infection. These three things I don't want you to forget. These are the three things you see a viral medication. Therefore, the major side effect, it causes nausea, it causes anorexia, you're going to increase taste. But the word said concerning. A pinpoint red spot means myelosuppression, and that is platelet problem. This is what we call petechia. And so this is bad. Patient has myelosuppression from giving them acyclovir. That is content you have to know when it comes to antiviral medication. So this is your right answer. Okay, so I explained it very short, myelosuppression. So, and let's provide care for a client receiving, same thing, Tobramycin. I've given you the content already for this question for infective endocarditis. As the nurse prepared to administer the fourth dose, which finding need immediate notification to the air care. Let's break down the question. A bunch of words, right? Tobramycin and then notification. Those are the only things you need to focus on. Tobramycin and notification. That's all. Then you come here, you say, what is thrombolysin? It's aminoglycoside. And I've told you what they are. What is the three main functions of aminoglycoside? I've told you, if you remember them, then you can answer the question. So which one? Need a follow-up. So I try to break down the question for you, and then it will be easy for you to pick the answer. When you're alone taking the test, I want you to do it, please. Do it like that. It will be easy. I focus on the buzzword. I told you to focus on thrombolysin, and then ask yourself, what is thrombolysin? It's aminoglycoside. What are the three main side effects of that? Then you write it down, and it said notification. So if I know if it affects your kidney, it affects your ear, and then you affect your neurons, creatinine 1.1 is fine. PUN is fine. It's making a lot of urine. Therefore, test taking strategy, you got to pick C. Otherwise, if you don't do that, you'll be tempted to pick creatinine. And you see, so but if you break it down, you know, hearing problem A, authenticity is bad, and it's a permanent damage. So that's the one we got to call the doctor. So I give you aminoglycoside and nephrotoxic, authentic, and neurotoxic. Urine output, BUN, creatinine are normal. Vertigo and tendinitis are early signs of authenticity when ignored will lead to permanent hearing damage. So these are the way I explain this as short much as possible. I don't like writing too much. Brevity is the best way. And this is another key concept. There's only one concept for this question. And there's provide care for several clients in immunization clinic requesting for inactivated influenza vaccine, which client can safely or not safely receive the immunization. Okay, that's all. Rewrite the question. Complete the chart below. Who can receive safely? Underline buzzword. Don't read the question multiple times. Go for the buzzword and focus on it. And they need what? Inactivated influenza. That's all. Then come out with your content. Don't just go and look at the answer choice. You said, what is inactivated influenza vaccine? And who can get it safely? That's all. That's all. That's all you need. And then you do it. So try answering them. And then I will give you, it's a one-word answer. And you'll be surprised how one-word answer can help you answer the question. That's the key concept. So which of this? 10-month-old, he has atrial defect. 5-month-old, small atrial septal defect. 3-month-old, he has no medical problem. 10-year-old, he has diabetes. 35-year-old, he has HIV. 75 years old, he has a COPD. Who can safely get inactivated influenza vaccine? Go down to your content and figure it out. And I know you get it because you watch Adapt NCLEX. So which of this patient can get it? To get inactivated influenza vaccine, that means not a live one, it's not non-live one. So it's the IM form. You have to be at least 6 months. That's all. So who can get it? Now you know the answer, right? Who can get it? You know the answer. So I've given you the answer. So who can get it? You have to be 6 months. 10 months old, fine, you can have it, safe. 5 months old, you are not safe. 3 months old, you are not safe. 10 years old, you safe. 35-year-old, you safe. And 75-year-old, you safe. That is the content. You have to be at least 6 months before you can get it. So then you can answer the question. You see that, and then the question became easy. If you don't do that, you're just guessing, come out with the content that will be your guiding, your light. You're looking at, you focus on it. 6 months, every question, look at it in the lens of 6 months. And then you can eliminate, right? So that's the answer, guys. For inactivated influenza vaccine, the minimum age is 6 months. That's all. And then you can use it to answer the question. NS is teaching new graduate about nephrotoxic anti-infective agent. Which medication below the name should include in the teaching? If the questions are hard, just let me know. If I need recommendation on the question, are they straightforward? Are they like cumbersome? You can type in, let me know. But this is like questions I create so I can see if it's clear to you guys. And Nancy is teaching new graduate about nephrotoxic anti-infective agent. Which medication below the name should include in the teaching? What is the buzzword? There's a bunch of big words there. I intentionally. I said nephrotoxic. It means kidney. Which one it can affect your kidney? Anti-infective agent, antibiotic. So which antibiotic can affect your kidney? That's all. There's some class of antibiotic that you should know that can affect your kidney. That's all, right? So what are those class of medication? You see, I wrote this long sentence. I just make you focus on 2 words. Nephrotoxic anti-infective agent is an antibiotic. Which one is include? Do you know class of medication that are what? And nephrotoxic, everybody know vancomycin, so I'm going to pick it for you, right? This is the way I'm talking. This is the reason why I do this test taking strategy. I know macrolides are not nephrotoxic. They can potentiate the effect, but macrolide are not. Therefore, if I see a macrolide, I'm eliminating it. So this is a macrolide, it's gone. Gentamicin is aminoglycoside. So I'm picking you. All aminoglycoside are what? Nephrotoxic. Clarithromycin is what? It's a macrolide. It's the same thing as erythromycin. That's why not every mycin is nephrotoxic. You see, I've created this question for you to, next time you won't get it wrong about nephrotoxic. Just because they are mycin, they're nephrotoxic. Macrolide, which also have mycin, erythromycin, clarithromycin, and macrolide. Amikacin and gentamicin are aminoglycoside. They too, they are nephrotoxic. Tobramycin and amikacin and gentamicin, they are aminoglycoside. It's nephrotoxic. How about amphotericin B? Who knows what it is? Amphotericin B. So this medication is antifungal. It's fungal medication. It's not antibiotic. Somebody get it. Antifungal. It's a powerful antifungal. So it's out. It's a powerful antifungal. And cephalosporin as also can be nephrotoxic. And so that also is also nephrotoxic. So these are the nephrotoxic medication. Amphotericin doesn't affect your kidney too much. These are the things: aminoglycoside, vancomycin. Those are the typical nephrotoxic medication. Okay, so this is just to let you know some of these medications. The next report, watch this question. It's a client report red blotching of the face, neck, chest during vancomycin infusion in the past, right? Which of the following is the priority action for the caring nurse to take when preparing to infuse vancomycin for this client? You say, oh, this is hard, let's break it down. Which of the following priority action? I have to take an action, underline, for the caring nurse to take, so implement when caring for a client about to infuse this for a client. But what did the client say? The client report blotching of the face, the neck, and the chest during vancomycin infusion in the past. Now you want to infuse the same vancomycin to the patient. What are you going to do? Prioritization, test taking strategy. But you have to know a little bit of content. Give the medication over 45 minutes. Check the peak at 15 to 30 minutes before administration. Pre-medicate with antihistamine and notify the air care provider. This question, I said it to like text you guys. Sometimes it came to me and I said, no, I got to test it. So this is testing your mind and see, what do you pay attention to? If you get it wrong, it's fine. But there's a key thing here. There's a blotching of the face, the neck, and what? Chest during vancomycin infusion in the past. Now you want to infuse something again. What are you going to do? What should be your priority? Do you infuse it over 45 minutes? Check the peak 15 to 35. Give them antihistamine and notify the air care provider. I intentionally said this question. If you get it wrong, it's okay, guys. No, but that is the learning process. So this blotching of the face and the neck and the chest is Redman syndrome. And this happened in the past. So he has a history of Redman syndrome when he gets what? Vancomycin. That is what the question is saying. Now he's in the hospital. We are going to give them vancomycin again. What are you going to do? Remember, Redman syndrome is not an allergy. No, it's not. It's just a reaction. Why does it happen? It's because you're infusing the vancomycin too fast. If you don't know, you should join the membership because I have a bunch of videos. I've done this multiple times on Adapt and class. You can join the end of the membership. I make some videos about it. So vancomycin, or come to our crash course. the red man syndrome is because you're giving the antibiotic too fast. And they have this flushing, but it's not allergic reaction. You should give the vancomycin minimum 60 minutes, so 1 hour, to prevent red man syndrome. Therefore, 45 minutes is wrong. You will not check somebody's peak 15 to 30 minutes before administration. You check the trough. This is the trough. The peak is checked 1 hour after the medication administration. This is hypersensitivity reaction because you're giving the vancomycin too fast. You got to give them antihistamine. You call the doctor, he will tell you, what am I going to do? No, he has a history of red man syndrome. Nurse, slow down the transfusion, at least run it over 60 minutes. That's all. If you get it wrong, it's okay. But I made it hard so that you can think about content related to vancomycin. This is how I can give you content about vancomycin. So we got to pre-medicate this patient with antihistamine to prevent future red man syndrome. Okay? The client is describing red man syndrome. This is not an allergic reaction. It's due to fast infusion of vancomycin. Pre-medication with antihistamine will minimize the effect. That is all the explanation you need. Thank you for watching. So that's that. And let's provide teaching to a client about newly prescribed Rifampin as a monotherapy for latent tuberculosis. Which statement made by the client will require follow-up? This is another thing I want you to think about. The key word is Rifampin. I know everybody knows Rifampin. If they give you this, don't freak out. Don't worry. Say, oh, I know Rifampin. It's the same thing. Rifampin is the same thing. It's a tuberculosis medication. What do you know about it? That is what this is testing. Which one requires follow-up? So 2 words, Rifampin and follow-up. Those are the buzzwords. The content is what? My secretion will turn orange red. I will take this medication for 3 months. I will call with tea-colored urine and clay-colored stool. I will need lab draw periodically for monitoring drug effect. So what is the right answer? What is the right answer? Rifampin, which of these need a follow-up? Which need a follow-up? Which of these need a follow-up and why? Why does he need a follow-up? Secretion is supposed to turn orange, yellow, red, so that's normal. TB medication, the minimum you can take is 6 months. So 6 to 9 months. So this one need a follow-up. When your urine turn tea colored, it means your liver is affected. And he said he's going to call. So that's good. You need a lab draw to prevent liver injury. So that's what LFTs will be checked periodically. So that's the right answer. And that's the explanation I give you, right? Three months is not a long time. So it's not a long time. You take TB medication 6 to 9 months. So it's not a long time. You take it for 6 months, 3 to 6 months. You take it 6 to 9 months. Sorry, 3 months is not enough. And NENS is providing discharge instruction to several clients prescribed monotherapy tuberculosis medication due to positive Malthus test. Which information the NENS should include in the teaching? Pair appropriate teaching with medication. I give you TB medication you're supposed to know, right? TB medication you're supposed to know. I give you the side effect, and I want you to pair them. Which pairing is appropriate? So tell me, guys, you got to help me. So which pairing is appropriate? Which pairing is appropriate? Isoniazid, rifampicin, and tabitol, pyrazinamide, and RTV medication. So which pairing is number one? So where does isoniazid, who does he pair with? T-called, gouty arthritis, risks of peripheral neuropathy, barrier method, risks of optic neuritis. So isoniazid, you pair with peripheral neuropathy. That's what somebody said. Rifampicin, who does he pair to? Rifampicin, who does he pair to? These are contents, you got to like pull it out straight, right? Rifampicin, who are you going to pair with? Rifampicin, who are you going to pair with? Use of barrier method, Entabitor, optic neuritis, pyrazinamide, gouty arthritis, and all TB medication causes T-called urine. That's a liver injury. So those are the medication. This is the pairing. This is what it would look like. All of them causes T-called urine, and that's how you can put it together. But these are side effects you have to know about TB medication for all of them, and that's how you can remember them. So pay attention to that. And next, receive an order to infuse vancomycin for a client diagnosed with MRSA infection. Which action should the nurse take to safely administer the medication? I'm just giving you content related to what? Vancomycin, in case you see somewhere. Okay. So in case you see somewhere, what are the things you need to know about vancomycin, right? And what do? We already seen it. Pre-medicated with antihistamine to prevent Redman syndrome, right? So we already seen that. I've already told you, you got to infuse over 60 minutes. So 1 gram over 60 minutes, right? Most of the time, we prefer central line. But if there's no central line, you can take peripheral line. And because it's a vesicant, it can cause, you got to check the site. That is vancomycin content in 30 seconds. That is vancomycin content in 30 seconds. So I saw somebody said, talk more about vancomycin. That's what I've given you. Everything about vancomycin in 30 seconds. You prefer a central line. If there's a peripheral line you got to use, you have to infuse it over 60 minutes, at least 1 gram, and then check the side because of side effects of extravasation and pre-medicate the patient. So those are the things. A nurse is infusing vancomycin to a client diagnosed with MRSA infection of the leg. The nurse suspects client is experiencing vancomycin infusion reaction. Which finding is consistent with this process? Sorry, I'm not trying to be hard, but this is the things I want you to know. So we go take the test, you see that the test is easy. Which the nurse suspected the client is experiencing vancomycin infusion reaction. What are the findings of vancomycin infusion reaction? What is the meaning of vancomycin infusion reaction? This is the test taking strategy I want you to take from today. What is the key word for that? Vancomycin infusion reaction. What does that mean? It means Redman syndrome. And what are the features of Redman syndrome? I already given it to you. Flushing of your face. It's going to involve your neck. Your face and your head and your chest is going to itch. You can become hypotensive, but you're not going to have hives. You're not going to have wheezing. You're not going to have angioedema. You're not going to have respiratory distress. These are all allergic reactions. So E, F, and G, and H are allergic reaction, and A, B, C, D are Redman syndrome. Why did I do this? To show you a content that your board would trick you with, would trap you to. So the first four are consistent with what? Redman syndrome. And the last one is what? Anaphylactic. There's two that can cross. You can find it in Redman syndrome, and then you can find it in anaphylactic. Which one do you think? There's two of them. You can see them in Redman syndrome, and then you can see it anaphylaxis. What are those? Hypotension and the flushing of your face. This and that can be part of this as the anaphylactic reaction. So when you see somewhere, they give you a table and they say compare them, that's the way you do it. So those one can cross over. I think I explained it. Flushing hypotension can occur in both conditions, anaphylaxis and vancomycin infusion. This one is a little bit hard, so but I will give you the content. A nurse is performing intake history on several clients requesting intranasal influenza vaccine at the immunization clinic. Which client the nurse know can safely receive this type of vaccination? It's the same question I asked you, but I twisted it. This one I changed it to what? Intranasal influenza. Remember, intranasal is a bad one. That is the activated one. This is a live vaccine. So that's the bad way. So which one is a live vaccine? So this patient is receiving live vaccine. Who can get a live vaccine? That's all. Do you know who can get a live vaccine for influenza? The content is what? You have to be what? Less than two, you should not be less than 2 years, and you should be not greater than 50 years. And then you should not be immunocompromised. So that's the content. So this is activated one. So if you're less than 2 years, you can get it. If you're more than 50 years, you cannot get it. If you're immunocompromised, you cannot get it. So the question is, who can safely get it? It's 45. It's greater than 2 years and less than 50, right? So he can get it. This guy is 45-year-old. Yeah, it's greater than 2 years and less than 50. But look, he has GBS. It's not healthy, right? After previous flu vaccine, after you've had flu vaccine before and then you get GBS, we're not giving it to you. He's 55 years old. He's more than 50. He cannot get it. He's 1 year old. He's less than 2 years. He cannot get it. I did not give you age, but I told you he has CD4 count of 100. He's immunocompromised. He cannot get it. He's 2 years old, but what is the problem? Long-term therapy with aspirin. You cannot get influenza vaccine that is live. It's 45-year-old. He's getting chemotherapy. Even though his age is good, he's getting chemotherapy. He cannot get it. He's 25-year-old. His age is good, but he's pregnant. He cannot get it. A 55-year-old, his age is bad and he has severe COPD. No, you can't get nasal flu. And a 3-year-old is getting immunoglobulin for Kawasaki. You know, if you get Kawasaki disease, you cannot get live vaccine when you get immunoglobulin for minimum 6 months. What did I do? Content, 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 all over this question. So there's only one person. A is the one who can get it. That's all. Okay, so there's only one person. So that's that question for you. So that one is a little bit harder. This is the opposite. Now you can figure out this one easily. A nurse at the immunization clinic is assessing client, I did not put for the more than for client receiving IM influenza vaccine. So what is IM influenza vaccine? This is the what? Inactivated, right? Which client should be able to safely get this? I've already told you who can get safely receive inactivated vaccine. Who can get, I told you, anybody greater than 6 months. So if you're greater than 6 months, you can get it. So it's not a problem. That's all. That's the first thing we're going to give this to. That's all. Anybody greater than. So this guy, 6 months, he's going to get it. 5 months, you cannot get it. 6 months, but what? He's allergic to what? The vaccine component. He cannot get it, right? 45-year-old is greater than 6 months. 45-year-old with HIV. Remember, HIV cannot get the live one, but they can get inactivated one. And 20, somebody who is pregnant cannot get the live one, but they can get inactivated one. So those are the ones that can get it. C is allergic to the vaccine component, so it should not be getting it. The C should be out of it. So that's the patient who shouldn't get it. Why did I say these questions multiple times? Because I don't want you to miss it in case you see it somewhere. And next, provide care for a client who is HIV positive and has a new 1-month-old newborn. The client is requesting HIV testing for their newborn. Which response by the nurse is accurate? Well, she's HIV positive. She had a 1-month-old baby that was born. And she want to test the baby. She want to test the baby. What are you going to do? She tests the baby. What are you going to do? How are you going to test the baby? She want the baby to be tested. You said your child will need HIV antibodies. There's no need for testing. Your child will need DNA testing. The child will receive the zidovudine that was received will give the make the test inactive. This is just to test you. When the baby is born, there's antibody crossing around back and forth. So if you test for antibody testing, it's inaccurate. It's not right. You got to look for DNA. So DNA is the best way to test for kids who are born with HIV from the HIV mother because the antibody is already crossed the placenta. So the best way is to get a DNA testing. So DNA testing is the best way. I think we're almost done. We've seen this question, but it's a little bit different. A nurse has provided teaching to a new graduate about Amphotericin B. Which statement by a new graduate indicate teaching is effective? I already given you some idea about Amphotericin B. I intentionally put this question here to know. And this is just for content. Amphotericin B is not for viral infection, it's for fungal. So 4 is out. It's one of the powerful antifungal. It causes a lot of problem. Okay, when infusing it, you're going to have fever, you're going to have chills, you can have rigor. Because of that, the nurse has to be watching you multiple times. This is one of the antifungal that is dangerous. It's like vancomycin. We have to be around while you're getting it. Because of that, to prevent fever, chills, and rigor, we give you what? Acetaminophen, we infuse saline, and we give you Benadryl. So these are just the content to know about this medication. I've given you everything here. Because of these features, this is true. We give you that, we give you acetonic, that, but it's not for bacterial, it's a fungal medication. And let's provide care for a client with severe influenza infection, which the nurse should obtain a prescription for which medication. This is my favorite question so far. What do you guys think? What is the buzzword? Let's analyze this question and let me show you how you don't have to know this, but you can answer the question. What is the key word here? in the question, what is the buzzword? What is the buzzword here? What do you guys think? What is the buzzword? And let's provide care for a client with severe influenza, what? Infection. What is the buzzword? I can show you it's influenza infection, right? Severe. What prescription should we give? What prescription should we give? Okay. Ask yourself, what is influenza? It's a viral infection. What medication are you going to choose? If you have to give somebody who has a viral infection, what kind of medication you got to give them? Antiviral. Therefore, if you're going to get antiviral, penicillin is not antiviral, right? So it's gone. Okay. So that one is completely eliminated. And we already know amphotericin is what? Antifungal. So that one too is gone. Now you have two options. Your chance of answering this question is 50-50. If you know it, fine. But if you are able to eliminate B and D, I'm happy for you because now you're thinking. You're thinking smart. Like, okay, I know B is penicillin is for antibiotic, is for bacteria. So there's no way I'll use it for antiviral. Amphotericin, what? B is antifungal. So it's eliminated. So you have two choices, A and C. If you know one, I know we've seen Acyclovir and we saw it is for herpes. Therefore, you'll be left with this. This is the most common medication we use for a flu vaccine. If you have the flu, so or Tamiflu. This is the way I want you guys to think when you answer a question like, oh, this is not for that, so I don't have to pick it. So you will be left with that. That's all. And then provide care for a client receiving IV erythromycin, which action by the nurse is a priority. We've seen this, and I keep on repeating them because in the different way so that you can master it. Erythromycin, put it in the class. Is a macrolide. If it's a macrolide, common side effect of macrolide, QT prolongation. We saw it already. QT prolongation, causing torsade. If you're going to do that, which of these answer choice you pick? That's all. You see how I break down the thing? IV erythromycin is a macrolide. Macrolide are common, causing QT prolongation and torsade pontes. Therefore, what are you going to do for this patient? Monitor his white count. What is he going to help you? Request a ondansetron. That's the key. If you choose C, then I give you the content because if you choose C, I'll tell you, look, ondansetron also causes QT prolongation. It's a trap. Ondansetron also causes QT prolongation. If you pick C, now we have two things that is causing QT prolongation. Patient is going to get torsade. So, and then you come here, liver function test and me monitoring your heart. Which one is more prioritized? Be sharp when you select your answer. And being sharp, I'll choose B rather than checking a lab work. I'm continuously monitoring you rather than checking your lab work. So that's why I put it here, very short. Same question, but this one I make it a little bit. A nurse provide care for a client with confirmed HIV infection. The nurse anticipate the primary healthcare provider to prescribe which medication. This is one of my other questions I want you to start thinking, right? You look at it, somebody give you a question like that. It said patient has HIV. I know it's a viral problem, right? And then it asks me what medication I'll use. I look at it, I say, why this is VA, VA, VA. But this guy is different. He's an outlier. He's completely outlier. And he's an HIV. And then you tell yourself, look, Acyclovir, and look at it, Vala Acyclovir or Va Acyclovir. This is the same. It look at the same as this. Acyclovir and Va Acyclovir are used to treat herpes. And we already saw this is for flu. Then the last one, zidovudine. This is antiviral, antiretroviral medication for HIV. So if you don't know, this is the true medication for HIV. So this is what most people take for monotherapy. And the last question, and then we're done. And let's provide care for a female client in the family medicine clinic with UTI. The client is prescribed doxycycline at discharge, which action by the nurse is a priority. I can tell you, doxycycline is a tetracycline group. One of the problems with tetracycline group is what? They are teratogenic. They are photosensitive. They can cause agranulocytosis and other things. But the most common side effect for this particular question is related to what? This lady, she's young, she's getting doxycycline. What are you going to what about? I know you're going to get oral contraception, but right now, I want to make sure you are not pregnant. Okay, I want to make sure you're not pregnant. Recommending oral contraception is not the right thing. I got to make sure you're not pregnant right now before I give you the medication. Because if you're already pregnant, it's too late. So D is your right answer. So C is your right answer. Sorry, C is your right answer. So this is adapting class. Thank you for watching. Like I said, if you want to join our crash course, this is where to find me. You can email me. We start this Saturday. Good luck. If you want to join our membership too, YouTube, you get all this content over there. Like I said, this is our pharmacology series. We have done cardiology, respiratory, endocrine, musculoskeletal. I think I posted that one. So this one is anti-infective. Thank you for watching. I hope you learned something. Stay taking strategy. Good luck in your exams and keep charging as always. Best of luck. Bye-bye.